Hi there! If you're looking for a job at DHB or mag-i-interview pa lang, this video is for you. I asked some people I know who also had an interview sa hospitals, and I've compiled these interview questions para meron kayong idea. Based on my observation, their questions are usually categorized to personal, professionalism, teamwork, treaty of waitangi, and cultural safety, of course, and fifth is situational. Well, it would be great if you can expand your answers enough to give them an idea. And honestly, I also checked TikTok videos on how to answer this type of questions and just twist it so that it will coincide with your profession. So let's go to the first one, personal. I attended 2 interviews and both of them asked me this question first. Tell me about yourself. So dito, I gave them a brief educational background and my professional background as well. Second question is, how did you know our institution? Or why did you choose to apply here? Or why do you want this job? So basically, prior sa interview, you should get to know the hospital that you are applying for. Get to know their mission, vision, and values. Kasi both of my interviews asked me whether I know the values of that hospital. The first one, well, I didn't. So, sabi niya, it's okay. Sinabi niya yung values. And then, among those 4, pinapapili niya ako saan yung favorite ko. So, you should really know the values, mission, vision of your hospital. Another question was, what is your greatest strength or weakness? Maybe you can mention the ability to focus, like initiative, critical thinking, time management, ganun. And so weakness, ikaw na bahala, basta wag masyadong deadly. Tapos, I think this is the most difficult question I've ever encountered. Di ko alam bakit. Kasi it can be interpreted in many ways. So the question is, what is your greatest weakness when it comes to communication? Hanggang ngayon, wala pa rin akong answer. So, yun. How well do you respond to pressure at work? And how do you cope with pressure while you're on duty? And how do you cope with pressure kapag wala kang duty? So, iba-ibang technique. If you're going to watch other YouTube videos about interview questions and search over the internet, you can see a pattern. Yung mga questions is nag-revolve lang din around these questions that I told you. It's just iba-iba lang ng pagkaka-phrase. Basically, that's it. You just have to understand the question. Basta mag-interview ko lang 1 million times. And second question is professionalism. Meron bang word na yun? Basta something about you being professional. So in this type of questions, they want to know how you would deal with a very difficult situation with a patient, relative, co-workers, or other members of the healthcare team. Basta dito, yung emphasis lang is that you have to act professionally. So some of the questions include, dapat pala sinama ko to sa personal. Describe your typical day at work. And what are the things that you need to develop? I think yung answer ko dito is that I have to be more knowledgeable when it comes to different cultures. Kasi here in New Zealand, you get to meet a lot of people with varying backgrounds. There's nothing wrong if hindi mo naman alam lahat. So that's what I told the interviewer. Another question is near miss or error and what did you do? So syempre, hindi naman tayo perfect. Basta yung point is, wag masyadong critical yung mistake. They can also say, tell me about the time you failed. Ganon. How do you manage patients' relatives? In both of my interviews, I was asked whether meron ba daw akong na-initiate na program sa hospital where I previously worked and what was the result. Another question is, how did you deal with someone who was not satisfied with your care? So ayun, take 3. Kasi yung first, hindi na-record. Second, na-record pero walang audio. And hopefully, tama na tong take 3. So I think we stopped at professionalism. So I think there was a question about how did you deal with a patient who was not satisfied with your care? Describe a time when you had to deal with a difficult patient and how you handled it. The next question is that how do you manage conflict between coworkers? Another question in relation to that, tell me about a situation when you had to deal with a difficult colleague. So as you can observe, yung questions nila is about conflict resolution and how you're going to deal with it professionally. I was also asked, how do you respond to an unprofessional doctor? Since they're also going to test your delegation skills, they're gonna ask you, when was the last time you did with your delegation? Tell us what happened and what was the outcome. Tapos, since they're keen on training new staff, they ask me about how am I going to precept a new staff. So for the third category, easy lang naman. Regarding teamwork, they're gonna ask you whether are you a team player? Are you comfortable working with other doctors or nurses? Regarding sa Treaty of Boitani, their question was not that specific. So, hindi na ako tinanong regarding Maori models of health. They just asked me how I'm going to apply Treaty of Boitani and cultural safety in my practice. I just gave them a brief explanation and then an example. Yun lang. For the fourth category, which is situational, it depends on your area of practice. So, para sa akin, because I've been working as a medical nurse for more than 6 years, pang medical yung tanong sa akin. So, I was asked, what if may nakita kong nahulog na patient? Tapos ako lang mag-isa, what am I going to do? How are you going to give medications to a patient? And what will you do if that patient refuses? Well, it's up to you. Anong gagawin mo? So, when they're done asking you all the questions, they're going to give you an opportunity to ask them your questions. So, tinatanong ko dito is, when will I expect to hear back from them? And, depende sa diskarte mo, you can also ask them, kung i-offer sa'yo yung position, ano kayang sang step ka? And it would also be nice if you're going to ask, if you're going to let them describe what the typical day in your future position looks like. Before I end this video, these are some tips before you start your interview. First, always check your internet connection as well as your devices. Unfortunately, I had bad experience about it, and this was during my first interview. So, if I were you, check your devices, check your connection, try Zooming with your friends. You can apply for job as early as you're still on MIQ kasi just mention in your CV that you still have to undergo CAP and yung isa-cite mong references was your previous colleague. Anyway, if they have questions, they're just going to call you or email you. If I were you, pag-start ka nang mag-practice. It's like, practice as soon as you can. Kasi kung aabutin mo pa nung nagka-CAP ka na, it's quite challenging kasi during CAP, you have to finish your activities and your assignments. Tapos, mapipressure ka kung meron ka pang interview the next day or something. So, it would be nice if you already familiarize the questions and gawa ka ng script. Tapos, basahin mo lang ng basahin hanggang ma-familiarize mo. Just keep on applying. It's okay if you get rejected. I got rejected and I'm okay with that. Kasi, usually yung hinahanap nila is yung may APC registration na. So, but some hospitals accept kahit wala ka pang APC. Just like what happened to me. So, don't lose hope. So, I think that's it. Kung nag-interview ka na din and the questions they ask you was not included sa aking video, just put it in the comment section so that other people can see it. And if you have ideal answers, i-comment mo na din para mabasa ng ibang tao. So, I think that's it. Bye!